Good evening. Should be on.
No, I meant they're out, so you can.
Oh, okay. Good evening. I'd like to call the City of Menasha 2023 Budget Review Session to order. Please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Move that we adjourn.
If we could have the roll, please. And we're. There it goes.
Hi. Alderman Hammond. Alderman Lewis. Alderman Tom Grady is absent, excused. Alderman Ted Grady. Alderman Rapella. Alderman Nichols. Alderman Eisenach. Alderman Sevnik. All are present with the exception of Alderman Tom Grady.
Item D is public comments. We have no one from the public here this evening. So item E is Neenah Menasha Fire Rescue. Deputy Chief Kruger is here this evening. If you'd like to take it away.
Where's the chief?
The chief is at a Fox Valley Association for a business speaking engagement, so he asked me to step in tonight. Sorry about that.
Hopefully you get his pay.
Yeah, no. So, all right. So I had just put a brief PowerPoint together. The packet that's handed out is also basically a duplication of this. And then at the end of the packet is a full budget, 100% of the total cost between the two cities for the operation of the fire department. So. All right, just wanted to talk a little bit about our 23 accomplishments. We again had a recruit academy with Oshkosh Fire Department. Moving into 24, we're hoping to actually bring back Grand Chute, so it'd be 3 departments involved for next year. This year we did hire and get 4 new firefighters brought on board. We did go through a 2% dues audit, which was done with success. We, in this last year, have transitioned 3 different records management programs. There really is no one vendor out there that was able to satisfy all aspects of the department, so we had to learn 3 new pieces of software through this last year. So that's been fun. We did have 5 firefighters complete our fire officer certification, and then they also passed the state exam that's associated with that. Then we ran an in-house academy as well to get them prepared to be new officers and move up in the future. Happy to share that we received $122,000 in an EMS grant. Part of that grant is a vehicle that had been in the capital upcoming that we were able to remove, and that was a UTV that is stationed here in Menasha at Station 35. And then we were also received a grant through FEMA for $65,000 to apply towards a Plymouth, which is an exhaust removal system that is also at Station 35 as well. So good to get those ads and get those dollars through grants whenever possible. 24 goals. We'll obviously be preparing for a new chief who will be coming on board here at the beginning of the year. And we're looking at, with retirements, 4 new firefighters coming on board. Again, another academy in the spring. We just did actually complete the first phase of the process for looking for new candidates. So we had 18 candidates that came through the doors, and can't hire them all, but certainly some great qualified candidates. Correct, for firefighters. The chief process is the offer is accepted, and then just going through the process to make it official. So should hear that announcement, I would think, in the next few weeks. For next year, onboarding all of the new staff, and then really sitting down with the new chief and updating our strategic plan. We've made some great strides over the last couple of years. We keep always looking at the strategic plan and really bringing a new chief on board and having that updated and ready to go is a good goal of ours. And then the EOC as well. So obviously we had a great opportunity to use some funds to have training in this last year. And you'll see that a little bit talking about from the budget standpoint. The days of taking a room and having the old telephones and special computers and a lot of that technology is really bring your own device. So it makes it a little more affordable to kind of focus on the operation cost and not have a large expenditures for all those devices. As we found out even when we did the operation, we actually moved it out of the police department and went over and used the library, which was just a little more conducive environment for that. The only thing would be, I guess we're missing the generator portion of that building should the power be out. But it was great to have the assistance of the county I believe there was about a $10,000 grant more or less that covered the cost of that training this year. So good whenever you can do that. And we just got the results from that event giving us some guidance, and we'll be working on our operational plan for next year to include some of those findings. The budget itself is kind of a breakdown slide here of the Menasha's cost of the budget itself. Again, kind of similar to that same slide. This is in the packet, so it's just kind of excerpts from the entire packet itself. And same with emergency government, as you just mentioned. So some of the overall highlights from the budget, just to kind of give you the breakdowns of it. We had salary increases of $175,370, overtime increase of $40,000. That falls just essentially more in line with what we've been encountering with the overtime, expected overtime that's occurred. Some of that is because of the retirement. So as people retire, when they come back on in the spring, we have to fill those times between the person retiring and getting through the academy and running the academy and getting somebody onboarded. So there is a gap where we're filling in some overtime. So some of that is definitely part of that budgeted expense. So we're not budgeting that higher salary. We're planning for the exact salaries when they come on board and then planning for the overtime portion of it. And babies, right? And and the injuries that you never know about. But yeah, babies are definitely part of it. A young department. So health insurance, again, we're all battling those increases. So a little over $31,000 expected with the health insurance increases. Fringes, $167,000, and then some of the items that are we've asked for adjustments on the PPE increase of $5,000. Just the cost of the components are just increasing considerably, and we did the same almost last year. And as soon as you turn around and buy it, it increases again. So you're just to give you an idea. I mean, we're probably looking at an expense of anywhere from $5,000 to $7,000 to outfit a new firefighter with gear. So it's the cost of the equipment, the helmets, the gloves. It's an expensive item. And then they're good for 10 years, and we strive to actually have 2 sets so that there's always an availability if one set needs to be laundered so that they're available. So go ahead.
Shane, what do we do with the person who retires? What do we do with their coats and all their boots and all their stuff?
Sure. Well, what we would typically do with anything that's left over, again, the goal is kind of
to just pass it down to the
be able to
next guy?
pass it down, or when we bring in our interns or that second set of gear,
Okay.
that would be handed down so that it's all custom clothing. So
Sure.
when you're doing the interviews, we're always checking their foot size and et cetera.
Okay, so only hire somebody who actually can fit into the other guy's stuff.
Exactly. So,
Well, that's a good idea.
and then maintenance of motor vehicles, we asked for an increase of $40,000. That continues to just be a challenge for us on the cost of vehicle upkeep, component cost, technology that's involved in vehicles. Just as we all know that we drive our cars and take them in, just the operational cost is increasing. One thing I just breaking from there, we've been having a lot of conversation with Dad and talking about Menasha helping us on the maintenance side from a labor perspective, if we can avoid having to ship it out for some of the items. We do have an in-house mechanics that cover some of the light, and they can get into some drivability issues, but things like that are involving like air systems or brakes that we would have to take in to have a professional look at. We're looking to have more communications with Menasha to actually help us with those vehicle repairs and bring some of that cost down. And I can't say enough about that relationship and those opportunities that are arising to do more and more together with the city itself. So we're very thankful for that. We're going to have some more conversation, and hopefully that can kind of help curtail and control some of those maintenance costs for the vehicles. And for what it's worth, just to also pass on, the engine that we were expecting, I think originally for last year, did finally arrive last week. So in the next weeks to a month that it'll take to get it in service and get some of the equipment on, but we're pretty happy to have a new vehicle coming into the fleet, because we've had, again, a few issues we have been reporting with some of the engines and challenges and out of service. So it'll be great to get that new one on board here shortly before the end of the year. We also had increases with professional services, so that's really specifically the cost of the physicals. So the doctor visits that are involved, increases just like your health insurance. So the plan for that. And then public relations increase. Once again, we're doing more and more with the community and doing more and more together. And I'll again speak from Menasha PD and our relationship that just keeps being fostered and growing. We've got new management on the PD side, and they're eager to do things together. For those of you that saw the National Night Out and doing more and more together, those type of events. So we want to plan to do that, prepare for that, and do that in both communities. But kudos to what's going on over on the PD side. So we're enjoying that. I think we just got invited to a dodgeball event, so we'll see how that goes. But yeah, right. But so we're looking to continue that public relations and expenditures associated with that. And then PPE increase. I guess I was kind of talking more about the purchasing cost. The other one was the maintenance. So there's the maintenance costs associated, and this is the actual purchasing of the PPE itself, the line item for that. So those are kind of some of the highlights of the larger increases that you'd see in the specific line items for next year's budget.
Could you tell me what fringes are, please?
All of the extras associated with employees, the benefits.
Oh, okay.
So.
Thank you.
That's fine. Go ahead.
Thank you, Mayor. Thank you very much. I'm not sure if you can answer my question, but I'm curious as to whether or not the city of Neenah, well, let me back up a second. The city of Menasha has instituted some new policies regarding health insurance benefits, which are more aligned with the private sector. And so I'm curious as to whether or not the city of Neenah has taken advantage of any of those opportunities as well.
I'm not sure I could be an expert on
That's
those
okay.
negotiations. Geez, I can't speak tonight. But I can say that I know that they were looking at, I want to say roughly a 9% increase on the cost of insurance going into this following year and then they did come out with additional services and plans. And I feel like they're locked in for at least another year with the vendors, and then they might open up some doors to look at additional opportunities starting
Okay.
next year.
Shane, I think what Alderman Nichols is asking about is we have basically a buyout if you want to go on your spouse's insurance that the city would pay you. And I believe that Neenah has a similar option.
They have some options for that, yeah.
It's not quite the same as Menasha's, but I think they have a similar option if I remember right.
Thank you.
Alderman Sevenik.
Thank you, Mayor. I don't see it right now, but there was a piece of equipment that was used for maintenance that's portable, a lift. Could you address that a little bit more, seeing I guess I really didn't feel like I got my answer in committee. The importance of that, especially if we're going to be using possibly the Menasha City Garage, and then mostly everything goes out to Pierce.
Sure. That's not in next year's CIP. I believe that was in the longer outlook. I believe that perhaps that was.
I thought it was
20
this year's, wasn't it?
Yeah,
Oh,
I thought it
it
was out a couple years.
Okay.
And the thoughts around that is, there's currently a fixed
I couldn't
lift.
find it.
There's currently a fixed lift at the station.
Yeah.
That fixed lift would only lift cars, small trucks, small equipment. It doesn't lift a fire truck. So the request was put in to buy a portable lift, which is a completely mobile lift that can be moved to wherever location it would be needed. But it would primarily be housed at 35, where most of the mechanical work is done on trucks. So we would remove the fixed lift, which is aged and has some issues and needs to go. I think that actually was gifted from the street department some years ago. The mobile lift, again, would allow us to lift even a fire truck. So even for just small maintenance items, changing oil, things of that nature, the staff's crawling underneath the truck. So if we can lift the truck in the station and be able to do some of that maintenance even quicker and safer, certainly something we want to look at as this relationship grows. That was
Right.
not on the
That
table.
was going to be my
Yep.
next point, is that wouldn't that be somewhat dependent on what is available out at the city garage? 'Cause
Yeah,
it's a big-
absolutely. And the city garage has the same exact lift system. So, we got to take an apparatus out there, recently, and that's what really started fostering this conversation, was we took it out there and asked if they could help us, and they lifted it up, and we were able to do some diagnosis on a problem on the ladder truck. So, and they actually introduced us to a different type of lift that was even newer technology, where we were used to having cords dragging around. This was all,
Right.
Bluetooth type
Right,
operation, remote and control. So, yeah, certainly something we'll look at as the next year progresses. But in the current process, we would still continue to do a lot of the basic maintenance on the apparatus, and I think there would still be a merit for that lift from a safety standpoint and just ease on the staff. And what's great about it being mobile is it's not locked in. So if we, had to go do some other work at another location, if the apparatus is broke down, we could actually put this on a trailer and get it out to another location to do the work.
And then as far as our warranties on our trucks, would that have any effect that we're doing some of the maintenance ourselves, where they would say, well, you did those oil changes, or you did this work on there, and we can't really guarantee that anymore?
No, there's nothing that, like from Pierce that says that all service has to be done or all maintenance. If anything, it's our record management system that we are using, keeping track that we are indeed engaging in doing the maintenance is the most important part, because then we have something to come back and say, no, we did our oil changes. And we do work with the Pierce dealership specifically on the coolants and the items to make sure we're using everything that's approved for, like Cummins, Allison transmission. So any of the fluids that we do use are approved through them, and they have that in writing, and so that we're using certified items. As would the street garage, we do the same, it has to go through that same process.
All right, excellent, thank you.
So Stan, the lift is on page 460 if you look in your budget book, and it's in the 2028 capital improvement plan.
What was the page?
460. Alderman Nichols?
Thank you, Mayor. This page that's on the screen right now, those are CIP requests that are directly related to the city of Menasha, is that correct?
Correct.
Okay.
Well, in part, the engine is obviously a combined, but that's just the cost
The cost.
associated with.
Yes. Great, thank you.
Yep. So I guess I'll break into this page then, on the CIP request. Living quarter remodel, so this is a project to update the kitchen and the kind of the common areas. hallways and the captain's office in the front, coming out of the bays into the apparatus, from the apparatus floor into the main corridors. Pretty dated. And again, we were originally looking at this being a fairly expensive project, but once again, Thad and crew have kind of presented that they believe they can provide the labor. So this is primarily just materials, and then some of the staff from the fire department also help with the tear out. As I mentioned, yeah, we're great at tearing things apart, but I don't know if you want us putting it back together. So those dollars kind of reflect a lot of just employee effort to make that happen. And I know they did a lot on the PD side as well in this last year. So again, kudos to what they're doing over there and helping stretch the budget, get things done. The windows are, again, also at the station, 35 for that value. And then the fire engine has been on order. That vehicle is expected to actually arrive in '25. And I know Menasha had split that into a 2-year period. There is no prepayment on this truck, so the final payment's actually in '25. So that's when the full expectation to the vendor would be made. So, but like I said, for budget purposes, it was split into the 2-year cycle for the apparatus. And then the last one is kind of an annual replacement program that we put on the CIP, and it's some of the larger items as they list on the screen, between computers and thermal image cameras and some of the just items that, you know, have a 10-year life cycle, but they're a little larger dollars, so we kind of plan for that every year. And there's a little bit of an increase in that request over the last couple of years. Just again, you know, just like the PPE, everything just costs so much more, trying to keep up with the equipment needs. So that kind of buttons up the CIP request for '24. I know we've been kind of doing questions as we go, but if there's anything that you guys have for us. And then again, at the end of the packet is just kind of a breakdown line by line of the individual expenditures.
Alderman Sevenick?
You had your meeting then with the city of Neenah?
We did earlier this week.
Yep, and so they made no changes?
Nothing was recommended.
So the main changes the mayors did was to update the salaries based upon the retirement dates that we were aware of and the fringes that went along with that. And we did reduce the overtime slightly. It came into, if I remember, it was 115,000, something to that effect for both cities. Other questions for Shane? Looks like you had it all in your presentation.
All right, great. Well, thank you. And again, to the mayors, the councils, the support you've provided to get us through actually really an easier process. You know, we always look for ways to find funding outside, but we certainly have been very appreciative of the support we have to get what we have as a department and keep moving forward.
Do you want to give us an update on probably the most important service that you guys provide? The Santa float?
Oh, the Santa float. Yeah, absolutely. Those guys do a great job with that. There's going to be a presentation coming up, and obviously the season. So the new Santa float. So pretty amazing technology. I don't want to give it away anything special here. You'll see it soon, but we've definitely embraced the new in the new Santa float. So it's not just a new aluminum trailer. It's all the new components that are going on in the technology, and it's going to be pretty impressive. So, but a lot of effort's been going into it. They've been spending a lot of time. It's crunch time, right? Getting it all assembled. It's been an ongoing process for. I've seen action on it for 6 months already. So.
It looks spectacular.
Absolutely.
Okay, thanks much,
All
Shane.
right, thank you.
Take a minute to set up for the health department, and we'll go from there. I didn't know. Dan, are we still rolling? Okay. So we have Director Hyder here this evening from the Health Department, and we also have Chloe Hanson-Dunn here from the Senior Center. And I'll turn it over to you.
All right. Thank you for having us tonight. I am going to start with the intro of the Menasha Health Department, and then I'll quickly turn it over here to Chloe to talk about the Senior Center first. So Chloe doesn't need to sit through all the rest of our presentation if she doesn't wish to. Okay. So just the overview of our health department, our mission, vision, and values. So our mission is to protect and promote health and safety across the lifespan by building partnerships and providing high-quality services and guided by community needs. We'd like to see a safe and healthy community where everyone has the opportunity to live their best life. And we value teamwork, trust, communication, respect, and friendliness. I included this model of the 10 essential public health services tonight, just as it describes our public health activities that communities should adopt. It was designed to protect and promote the health of all people in all communities and centered around equity. Local health departments are one large partner in supporting and delivering the essential services. We play a role in assurance, too, that these services are happening in our community. And this model, along with the foundational public health services, which we'll touch on a little bit later in another presentation, or another slide, excuse me, those inform the work that we do as a health department. This is our organizational chart as we are now, so a snapshot of our staff. We have myself, the director, we have an office coordinator, a health educator, a hygienist, a dental hygienist, and currently 5 public health nurses. One is a limited term position being funded through COVID grants. We have our environmental health sanitarian, sealer of weights and measures, and employee safety coordinator. And we also have Chloe's position, our recreation and senior services manager. Beneath her, we have our senior activity coordinator and senior center clerks at the senior center. And then we have 3 other supporting positions in our health department: our Spanish interpreter translator, a dental assistant, and 5 school health aides. And then this is just the list of all of our separate budgets that the health department manages. We are fortunate to be the recipient of many local and state grants and other funding sources to help our department operate in a cost-efficient manner. I'll go through each of the budgets tonight, but as I mentioned before, we're going to start with the senior center. So I will turn it over to Chloe.
So I'd like to invite you to join me on a tour of the center. When you walk through our doors, you'll be greeted by a team member. It's our mission to maintain and enhance the quality of life of older adults by providing educational, recreation, social, and wellness programs, and meet the needs as requested by the community. We want to see a flexible opportunity for all participants in healthy activities, services, and friendships, and we certainly value opportunities, friendships, health, and learning. We are uniquely housed in the health department, which provides us wonderful support and services, which will be discussed later on. So to the right of our front desk is our River Room, which provides a space for talented groups for groups like our Story Circle, Breakfast for Your Brain, Knitters, and card players. Our activity room is off of the hall, which provides a space for our talented groups. This is the space for the talented groups, no other talented groups in the center, to make greeting cards, quilts, and then, of course, more game players. Our hall is our multi-use, which sees exercise classes, special events, open art time, games like shuffleboard and cornhole, and more game players such as dominoes. Our cafe is always open for coffee or tea throughout the day and sees many different users, including our wellness room, which houses many of the 60-plus grants and services that Christine will discuss later on, as well as our nail care. The cafe is also used as a programming space, as seen with our tea party with ladies in hats and Dan. I did try, we have so many pictures of Dan that I didn't want to have the slide be just all Dan. So he did, yes. Yes. No, he's sitting off to the side. So this space is used for different events as well as a kind of overflow space for our card players and mahjong, but also just for a space for people to sit, read, and relax a little bit. Our kitchen gets daily use with the Advocate meal service, with occasional use with special events or programs that are centered around food. We also rent out our hall and kitchen for community member use, and people are thrilled when we have a full service kitchen available. Our highlights include simply feeling the return of our efforts in more people choosing to spend part of their day with us. As you can see, we are continually growing with our average monthly number of visitors. I have 2009 data point listed up there. That kind of shows where we, or how our numbers have returned truly to previous to COVID and when the city was operating it at that time. In 2023, our busiest month was May, with 307 unique visitors visiting us 1,185 times, while they enjoyed 1,303 services. Just for a little bit of the background, at the time of, in terms of unduplicated registered participants, when they walk through the door, we capture their information so that we can track them throughout our system. So at the time of closure in March of 2020, we had 165 registered participants. This time in 2021, we had 368 participants registered. In 2022, we had 571, and currently we have 943 registered participants in our software, which we began utilizing in 2021. So the 2022 number was all tracked by hand, but yay for software. Yeah.
Question on the visitations in Chloe.
Of course.
So we monitor what city they're coming from and all that, you know. So is there something, a slide later on that shows the breakdown? Or is that something you can provide?
I can give that right now. So we are thrilled to have seen about 90 brand new City of Menasha individuals. So right now we have 311 City of Menasha, 79 Fox Crossing. We've seen a decent sized jump with Appleton participants, and I think that's just hearing the talk about, well, I have some hypothesis. I don't know, need to go into that, but we've seen a lot of jump with Appleton with 135, 216 Neenah, and then I'll explain a little bit as to why our other outside of those communities has jumped substantially to 196, and that is primarily our bus trips, which we'll be talking about shortly. So we're also really excited to share that we once again began offering nail care through Appleton nail nurse Kim Koch, who is an RN, which is very important, I think, to have that education and not just a nail tech serving our population. So she's dedicated in providing this important service at a friendly cost, and we fill up those appointments and have wait lists, and then often can get her in a second time a month, every month, I guess is what I want to say. We also successfully transitioned our newsletter, The Chatter, to be a bi-monthly publication, which helps save some mailing costs as well as, most importantly, be a little bit more efficient with our staff time. And then we celebrated our volunteers this past April, and I'll share about their fantastic impact shortly. So as I alluded to, our offerings are not just limited to inside our four walls. 2023 has been a year of exploration for the center. After a single-day trip trial in October of 2022, we hit the ground running with our trips. We've had 419 participants join us on our 11 trips offered in 2023, and they've traveled about 3,355 miles. So we certainly rely heavily on our volunteers. We have 19 wonderful volunteers that have gifted us 645 hours throughout 2023 as of the end of October. Dan just told me he's going to be volunteering for the luncheon at the end of this month, so yay for that. Some of these volunteers lead programs and classes for us. Others help us staff the front desk during busy peak transition times. And we are also very fortunate to have a volunteer trip coordinator, Donna Landers, who does a stellar job out of the goodness of her heart with many years of experience. Together, these volunteers make 6 different programs possible for our community that we would otherwise not have been able to offer, as well as the bus trips. It truly takes a team, and those who join us in living out our mission are AdvoCap, which provides lunch and freezer weekend meals for a low cost, Exercise Partners, the Y and Wellness Plus, which is a Winnebago County collaborative partner, and then the ADRC, who offers memory screenings and is just a wonderful resource for our staff members who have to deal with some difficult phone calls, and they're a great first call for us. And then the many city departments who share their time and knowledge with our participants. Our goals in 2024 are to continue building our volunteer and sponsorship program. We hope to obtain our accreditation from the Wisconsin Association of Senior Centers, which the application has been a huge project throughout 2023 and will be completed and submitted at the end of the year. So now why we're here is to talk about our 2024 budget. So we are funded with the Winnebago County Operations Grant, rentals, programming and fees for service, donations, and tax levy. Some of the highlights that I will cover are the 2019-07 account, which this page number is 348. If you have not been able to turn to, I'll pause so you can get caught up there.
Yep, that's what I was just going to say with this.
Because I don't want to forget it. The accreditation,
Yes.
do we get any like additional grants or anything if we get accredited, or what's the benefit of getting accredited?
Yeah, that's a great question. So as we write grants, certainly it's a wonderful thing to have on our, per se, resume. We have been accredited in the past, but it's also just a really great thing to be able to show to our participants that we have the best practices and we care about it, and there's a governing body who looks at us and says, yes, you're doing a good job.
Perfect, thank you.
Yeah. So our 2907 account, we're seeing an increase, and that will be a routine increase, not a ongoing dollar amount in there, because the software that I offered, we have to pay for that. So that we're splitting the annual cost of the rec desk with the Parks and Rec department, and we've kind of found that we do about 25% of the business that rec desk sees. And then our 3302 and 3303, we've moved to 3402 and 3403 to be more accurate with its use. And I will pass the mic on over to Christine to talk about our 1001 line.
Okay. So can you hear me? I couldn't tell. Okay. Our 1001 line, so wages, certainly you can see in our budget there that there's a jump. One of the reasons for this is the increase to the clerk position wages that simply came out of our salary study. And then the second reason is we're looking for a change to the senior activity coordinator position. You would have heard Director Sackett mention this position last week during her presentation for Parks and Recreation. Currently, this position works an average of 17 hours per week at the center, and we would like to make the position full-time benefited with a 70% senior center and 30% recreation split. So that would increase the number of hours that that position can dedicate to the center on average each week. And the goal of doing that would be to support the stability of our center operations and, as I have on the slide here, also growing our programming, which you heard Chloe talk a lot about, and building relationships with our community partners. That can lead to different funding and sponsorship opportunities, as well as additionally growing our programming and creating activities for our participants. Yeah, sure.
Oh, thank you. Okay, thank you. Is that person that you have kind of pigeonholed for this 70-30 position, is she currently working for you?
Yes, we do have somebody who is the senior activity coordinator currently.
Okay, so she's going, so you're kind of wanting her to go from hourly to a salary position?
No, not going from hourly to salaried, going from part-time to a full-time benefited.
Oh, right now, okay, so she's part-time but no
Yes.
benefits?
Correct.
Okay. All right, thank you.
Sure.
Thank you. That sort of answers what my question was. Is that person currently shared between the senior center and recreation?
Oh, yes, good question. That person is currently shared. The way that it is right now is 2 part-time positions, 1 in each department, essentially. So because of that, that person does not have benefits, but is generally working a full week for us.
Oh, that's fascinating. All right, thank you.
If that person is under 26, they're covered under parents' health insurance anyway. So unless we're hiring somebody who's a little older than 26, we can keep her kind of part-time and she still gets benefits from her parents.
I don't think that's really relevant. We
Oh.
cannot
Okay,
discriminate based upon if they can get health insurance elsewhere.
okay, I was just trying to save us a little few.
They can make that choice. We cannot select them because of that.
Okay.
So I think that that is the biggest change that you're seeing to the budget. Obviously, of course, we're proposing a benefited position too, so you'll see some increases to the fringe lines. But otherwise, Chloe hit on the other 2 kind of more notable changes to the budget. And I think that's all we had for the center, so if there were any other questions, we'll take them.
Alderman Nichols?
Thank you. One of the things the senior center has been working on is returning to its hours of operation and activity level that it held before the pandemic. So how are we doing on that?
So obviously, the operational hours are not 8 to 4, Monday through Friday, and we do not plan to move to that at this time. Part of that is we just can't find a good balance of the staffing and the coverage to have real ease. But we're also not seeing overwhelming, how do I want to say that? It's primarily the staffing concern to find the additional coverage for the return to Tuesdays and Fridays to 4 o'clock. Activity-wise, we are really, I struggled to find ways to look at the programming comparison from prior to COVID as to now. I'm finding some documents from archived when the city operated in the 10 years previous, so 2009 timeframe, that I think I'll be able to really speak to that era. But we have a very full calendar. You step into the center and truly you feel it. And we are often using every single room in the center. So I would say that without having true quantitative numbers in front of me, we have returned activity-wise to prior to COVID.
So Monday, Wednesday, and Thursday is 8 to 4?
Yep.
And Tuesdays and Fridays are,
8 to 1.
and those 8 to 1 days include the afternoon lunch?
Yes. Yep.
Okay. And then, I guess I don't fully understand the staffing issue that you're referencing, because we're talking about 6 additional hours to be open till 4 o'clock on those other days. So
Yes.
6 additional hours in the whole week.
Yep. It seems very small when you put it that way. So we have an 18-hour clerk doing Monday, Tuesday, and half of Wednesday. Then we have a 10-hour clerk or 12-hour, 10-hour clerk doing the second half of Wednesday with an hour overlap, and then all day Thursday. And then Friday is split between Leah or I. So with us being split on Parks and Rec, we often have requirements, and it's a juggling act with the other things that we've got going on.
Do you find that this is more of a challenge in the summertime?
No, I mean, yes, definitely. Summertime is a nightmare in terms of scheduling, but I wouldn't say that the challenge disappears after those 3 months. Do you want to add in or clarify?
No, I would just add that the number of hours that our staff, our activity coordinator and manager are able to provide is about 17 hours for one and about 11 hours for the other. And then, as Chloe mentioned, we have 2 part-time year-round clerks that are also staffing. So kind of what she alluded to, that staffing relies on a lot of the time only having one staff member there providing majority of coverage. And if we were to try to open even those just 6 hours, which doesn't seem like a lot, but we would just be barely able to scrape that by. And again, it would be more time with just one person. And our goal is really to find a way to where we can get to 2 staff members there as much as possible, because it can be a challenge for one person to sit at the desk and answer phones and check people in and help set up for the programming and deal with our volunteers that are in the building. And if something should arise, it's just a lot, it's a whole facility and one person being in there. So we just don't feel that we have the capacity right now to take on those additional 6 hours. Part of the reason why we're proposing a change to the activity coordinator is to really like support the hours that were open now, and giving that 2-person coverage more than we have. But I don't think that we're going to be able to change the Tuesday and Friday very soon. Does that make sense?
It makes sense. Thank you.
Okay.
Alderman Sevenick?
Thank you, Randy. Anyways, I'm looking at, in the budget itself, in the senior center organizational chart. So are you telling me then that, Chloe, in your case, you would change, you'd be 30% senior, 70% rec, and that the new senior activity coordinator, which could be Leah, would be 70% senior and 30% rec?
That is my current split, yes, and that would be remaining the same. And then, correct, Leah would have the 70-30, correct?
Opposite.
And as Randy had asked before, then it's really part-time. Is that meaning 30 hours or less with full benefits, or 35 hours or less with full benefits? That's where I'm having a difficulty figuring this out.
For the
For the
change,
senior activity coordinator change, yes.
We're proposing a full-time benefited position, so 37 and a half hours a week.
37 and a half hours.
Correct. But
Thank you.
the split would be 70% senior center, 30%
Got you now.
recreation.
Now I got it. I was confused from day one when the mayor talked about it, until I saw this chart. There just wasn't really the breakdown of
The
your
position.
involvement, but I got it now.
Good. Alderman Rapella?
Thank you, Mayor. Just a couple curious questions on this. So what would be the salary of the new person that we're going to be hiring?
The hourly wage would remain what is on our 2024 proposed or implemented salary chart for the senior activity coordinator position. So that's what they would be at.
So she's going to be salaried, but she's also paid hourly.
She will be an hourly position. I'm sorry if I said salary chart, I meant hourly chart.
She will be paid an hourly position. Okay, and
Based on 37 and a half.
I got that. But what is her current wages? Is that going up then?
Her wage will increase with the recommendation from the salary study. So going from 23, what she's making now, into 2024, yeah, there will be an increase. I can't remember exactly how much the increase is, but
Okay. All right. Okay, thank you.
sure.
Other questions about the senior center? Thanks for coming, Chloe. I'm not sure if you're sticking around for the rest, but we'll continue on to Health Department then at this point.
I might go set up gymnastics, quit.
Go ahead. Thank you.
Yes. Thank you all.
Is that for the senior center?
No, just trying to get ahead of the week.
Okay, so I will bring everyone now to the Health Department budget. This is our big budget, 0903. It's page 294 in the book. Let's see here. So just a little bit about the Health Department again. We're a level 3 health department designated by the State Department of Health Services. We're a little unique in that we do provide, of course, public health services for the city, but also school health services for the Menasha Joint School District. On the public health side, we do all of the services listed up there: communicable disease control, surveillance and investigation, chronic disease and injury prevention, nursing home visits, immunizations, community health improvement planning. Our governing boards is Board of Health, and then the Committee on Aging on the senior center side. And for school health services, our nurses act as school nurses as well and provide nursing services to students. School staff health training. We do some health screenings and health education in the schools. We manage student immunization compliance, and then we also teach CPR and first aid to school district staff and city staff as well. In 2023, some accomplishments here. So we did 2,383 school-based vision and hearing screenings last school year. Just over 1,500 school nurse encounters, so that's generally health room visits. 350 communicable disease cases. That has, I put in that comparable number there from calendar year 2022, because in 2022, you could really see the impact of COVID-19 still. And so 350 compared to about 2,400 is quite a bit different, as our cases reported have gone down. 37 home visits year to date, 194 childhood vaccinations administered during our monthly vaccines for children clinics. so far, again, year-to-date. 291 flu vaccines year-to-date, 14 car seat fittings, and then over 100 school staff and city staff trained in CPR and first aid. And then also adding that we are a host site for UW Oshkosh nursing students, and we host them every fall and spring. And then occasionally we have UW Green Bay students as well. Our 2024 budget here is overall fairly similar. Some notable changes are that we did separate our cost for language lines, so language services that we are required to provide to our residents who speak a language other than English. We had been charging those out of our department supply line, which doesn't really make a lot of sense. So we did create a new line this year for like language services, and there's a budget there now. And we did decrease our supply budget a little bit to offset that. We also shifted travel costs to the training budget lines. And then just a note again that we are partly funded by the school district as we provide services for them. And we're also funded by the levy. We do have fees for service, minimal, but we do have them. And then this year, until June, the end of June, we have a school nursing grant on the district side that is going to offset a little bit of some of the budgeted training costs we have this year. So you'll see those lines went up a little bit. And again, some of that is offset by that school nursing grant. Our objectives for the next year, we're similar to previous years. We're continuing to enhance our evaluation and performance management of our programs, always trying to maintain and enhance as we're able to our services to the community and the district with the staffing levels that we have. And always also trying to enhance our public communication efforts to communicate with our residents and the greater community. Our personnel listed there, we have about 5.45 FTE in total. And it is at least part of every position in our department is on this budget with the exception of our environmental health sanitarian. And speaking of him, environmental health budget is next, so it should just be the next budget in your book, page 299 or 300. I'm sorry, well, I did put the beginning of the program as my pages, so sorry about that. You'll see that everywhere now. So for our environmental health budget, we include everything here that our sanitarian does. So DAT CAP inspection, so that's Department of Agricultural Trade and Consumer Protection, where we have retail foods, pools, hotel, motel, tourist rooming house, and school food service inspections. Department of Safety and Professional Services inspections. We have a mobile home park, tattoo and body piercing establishments that are inspected. And then we have a contract with the DNR as well to provide asbestos commercial building demolition compliance oh, I'm sorry, yeah.
Thank you. Swimming pools. I know out in my district we have an enormous amount of swimming pools. So that means that person would go and check the chlorine levels of these pools, or what would they be?
Are you speaking of residential pools?
Yes.
We do not inspect residential pools.
Well, then we only got one pool that they have to worry about. Okay.
We have a couple in the city. Jefferson Park Pool, we actually do inspect
That's the
that
pool
pool.
yeah.
And Lake Park and Swimtastics.
Okay,
Yep.
Swimtastics, okay. Right.
We have a few. And then human health hazard investigations are also conducted by our sanitarian. All of those concerns listed on the slide. So some accomplishments, especially for inspections here, are listed. Of note, 33 human health hazard complaints and investigations done, 34 animal bite follow-ups, so that's our rabies control program. That could be domestic animals, wild animals, whatever the situation is. We work in partnership with our police department on that. And we did this year have one foodborne illness outbreak that was actually confirmed at a food establishment, so we did investigate that. And just of note, Todd, our sanitarian, was named this year the chair of our statewide local health department and board's environmental health section, so we are very proud of him for that. And in 2024, our budget for this budget does look similar. I did add some time for our public health educator to this budget, though that is why there's a little bit greater of an increase to the wage and benefits line, because that position does support some of the, in particular, rabies control services. And then as well as, things like website education and social media. We are,
Back to the slide here. You
Okay.
talked about the 34 animal bites.
okay.
This past year, the council did approve the ordinance for chickens in the city. So I'm just wondering, has there been any type
beaks
of
involved?
of concerns or anything brought up that Todd had to make visits to check the coops or check,
Yeah, that's
with-
a great,
I don't know.
that's a great question. Of course, he's involved in a lot of those pre-inspections before they get their permits. But no, we have not had any significant concerns, at least that I'm aware of. So that is good. And no, none of those bites were from chickens. So just of note, our budget is funded by license fees primarily and our DNR contract, where we can bill for $500 per inspection that we complete, as well as a little offset from the tax levy. Goals are the same: to continue with our inspections and following up with complaints, and then maintaining our contracts that we have and certifications for Todd's position. And then, again, a note of the personnel total is 0.71 FTE.
Thank you, Mayor. I'm back on the chickens. I want to make sure these guys are listening
I
to
wasn't
me.
prepared to talk about chickens tonight.
And actually, my question is serious. I just read that the state legislature, are you guys listening? Because they'll bring it up again. The state legislature is proposing ducks, chickens, other fowl, and I don't know about turkeys, but, so are you prepared for that?
I'm
If
sorry.
something like that
They
passes?
proposed.
There's a bill circulating.
Oh, I'm sorry, I didn't,
Allow them in all communities.
Oh, I got you.
yeah,
Okay.
in the Wisconsin state legislature, someone is proposing that all types of fowl can be raised now in your backyard.
I got you.
From ducks, and you think chickens are filthy, ducks are worse.
I guess I would just have to say we'll take that as it comes to us. Should that be
Just wanted to make
approved
sure
and
you're
passed?
aware of that as the
Yeah,
health.
I
Okay.
appreciate that.
Thank you, Mayor. Are the tourist rooming houses the same as Airbnbs and those sorts of things, or different?
Yeah.
Okay, how do you know where they are?
Well, between us and the finance department, they have to apply for a permit and license to operate. If somebody is operating under the radar, we might not know that.
Okay, thank you.
And we have charged double fees for a few of them that were operating under the radar.
Yes, very
and
good point. Our
were
fee
turned
schedule
in.
allows for extra fees to be paid when we find out that that has been happening, if it has.
I was just curious where hotel and motel is.
Yeah, we don't have
I
at
didn't
this
think so,
time.
but we
Sorry,
had
I
one,
just
and we
didn't,
tore
I
it down.
included because it's a part of the
Sure.
DACAT inspection suite. But yes, you're
Okay.
right. No, we don't have a hotel motel at this time. We have a number of the TRHs, tourist rooming houses.
Got it. Thank you.
Sure. Next is weights and measures. So this program is responsible for inspecting devices for consumer protection. So devices inspected include gas pumps, price scanners, scales, measuring of timing devices like laundromat dryers, and package weights. So essentially, we are there to ensure that the purchased goods and services are at the quantities and rates offered, so you're getting what you pay for. Year-to-date, 106 inspections. This is also our sanitarian doing this, our sealer of weights and measures, Todd, and with assistance from our health educator who can do pricing inspections. And just one complaint so far this year has been investigated. And then, of course, Todd is continuing the mandated continuing education. So this budget is very similar. There were no personnel changes to it. And it's funded by license fees. And for next year, we hope to do more of the same.
Thank you, Mayor. So when it comes to this portion of it, how much of your time would you say in a year is given specifically to this? More so just genuine curiosity for this aspect.
My time or the person, like our sealer?
Todd Drew.
For Todd, sorry.
Sure,
Thank you
no,
for
I just wanted to
correcting
make
the
sure.
question.
So we have him at a 0.2 FTE allocated to this. And I would say that's fairly reasonable. There are, like anything, there's ebbs and flows. There's sometimes that are really busy when you're trying to make sure that you get everything in before the end of the licensing year and such. But I would say that's pretty accurate. Our agreement with De Pere to utilize their equipment helps a lot when you're talking about those large gas stations and efficiency to test all those pumps. So,
Okay,
yeah.
thank you.
Sure. Okay, employee safety. So the health department does employ the employee safety coordinator. Again, this is Todd. So this program, as it says, is to assure employee safety. So we do training, we coordinate training to promote optimum work practices, and of course, the goal is to reduce and prevent employee injuries. Todd does respiratory fit testing for our employees, and he coordinates hearing screenings and also holds our regular safety meetings. We do safety meetings for the City Hall and Library, the Public Works Department, and the Police Department. So 3 separate groups there. Our safety coordinator also investigates reported employee injury reports and coordinates the purchases through our CIVMIC grant. So some accomplishments this year. So 13 employee injuries were investigated. We had a number of new employees this year, so 11 new employee safety trainings. He did hold those regular safety meetings, safety committee meetings, and then did that respiratory fit testing and coordinated the hearing screening. The budget is again, similar this year. The one change made was we did allocate a little bit of time for our office coordinator to this budget, just because of the amount that she does support administratively, especially when you're talking about our CIVMIC grant purchases that require tracking and invoices and making sure things have been paid and requests are submitted appropriately and such. So she does support Todd in that. Next year, continuing to update our safety manual and providing that employee education to reduce injuries. The CIVMIC grant that we always mention, just a reminder, it's kind of like a matching grant. It's $7,000 that they provide, so $14,000 total in that department line, plus the $250 for supplies needed for the program. Next, we have the Health Screening 60+ grant. So the program starts on page 309. Page 310 is the budget there. Get to this. So with this program, we provide older adult health screenings, education, and wellness activities. Year-to-date this year, 386 people have received 510 services. And just of note, we did extend our walking club into September and October, into the fall this year due to demand. It was a slow start in the summer, but we got a lot of new faces to join, and they were really interested in walking in the fall, so that was great to see. The budget is, again, similar, and it is partly funded by a Winnebago County Health Screening 60+ grant. Oh, I'm sorry, it is fully funded by that grant. Our prevention program is a small amount of money, about 4,600,000, or 4,600. And we use those funds to work on community health planning and working towards being ready for National Public Health Accreditation. This year, we implemented the internal performance management spreadsheet that was started last year with some updates. We updated that spreadsheet to include results-based accountability framework, which is I won't be able to describe it succinctly now, but just a framework to use to track where you've been, where you are, and where you want to go. And then we overhauled our tracking and updating system for our internal policies, procedures, and protocols. So we have a much more user-friendly system for tracking where we are in the status of our policies and procedures. And then this budget is funded by our Preventive Health and Health Services block grant through the state, which is CDC funding. So in 2024, we continue basically the work that we were doing this year, as well as we can utilize that money for our work with our Tri-County partners for our community health assessment planning. And the personnel on this is our health educator, a small amount of time for that budget. Oh no. Oh, okay. Next is our school health aides. Page 315, 316. So we do have 5 school health aides that work under the direction of our public health or school nurses, and they provide health-related services for our children in the district. So some accomplishment there, they respond to accidents, illnesses, and medical needs. Over 7,800 health office visits to the health aides, just the health aides, in the 22 to 23 school year, a dramatic increase over the past few years. And of note, we did hire 1 new health aide this year to replace a resignation that came in the middle of the school year. So this budget, you'll see, looks dramatically different. It really is actually just reflecting what it probably should have reflected last year. Our health aides were approved for a wage increase by the district in the summer of 2022. And since the pandemic started, they've worked additional hours per week. So that is also reflected fully in the 2024 budget. And that budget is covered by the school district.
Quick question.
yeah.
So does, Christine, does each school have their own health aide?
Not each school. We have 5 health aides. So I think we have 7 schools
6
now.
schools.
With
We had 7,
closure,
but
yeah.
Nicolay dropped out.
We had 8 and now we have 7. Okay.
6, yeah.
Yes, so the small one, Bonta does not and Jefferson does not.
Oh. Oh. Gotcha.
They have some school staff that are able to assist with the needs when the school nurse aren't there.
Oh, so Menasha High, Maplewood, Geegan, and Clovis have their own health aide.
And
Bonta
Beautimore.
and Jefferson must split one.
No,
Oh,
they
Beautimore.
don't split one.
Okay.
They don't have one.
Gotcha. Okay, understood. Yep.
Yeah. The dental program, page 318. This is our Menasha Healthy Smiles program. So we operate this program in conjunction with our dental sealant program to help prevent tooth decay in our district students and preschoolers. It's cost effective, it encourages dental homes, and helps prevent ER visits and hospital treatment when, by decreasing like urgent needs. So in the school year of 22 to 23, we had 1,366 children screened, 648 topical fluoride applications, 102 were referred to treatment. And with those referrals, our registered dental hygienist does provide a level of case management. They are trying to follow up with families and make sure that they get connected to a dental office that will see them and treat them. This year, we did apply and were approved again for funding by the United Way Fox Cities. So that investment was for 2024 and for 2025. The budget overall is similar. It is, again, funded by a United Way Fox Cities investment as well as medical assistance reimbursement. So our dental hygienist is able to bill Medicaid for the services that she provides for Medicaid or students or children who have Medicaid. Our communicable disease funding is, I'm sorry.
So obviously with the dental thing, I'm going to ask you the question of a follow-up with when I brought up to you about the dental program that you met with the area dental.
Oh, the Tri-County Dental Clinic?
Yes.
So we have not pursued anything different with them. They are still an agency that we can refer to. So students that we see that have needs, we generally refer to Partnership Community Health Center and the Tri-County Dental Clinic. I feel like I'm missing a word there. As well. So we do partner with them, but they are not providing any additional services in our city.
Okay. And have they contacted you since, or?
We had that initial meeting, and then we did meet with them once more with the district as well.
Okay.
Communicable disease is a small grant fund through the state. Oops, I just went one ahead. And we actually use this pot of money really for public education, so our social media and website, because it is, so small, it wouldn't even touch the amount of communicable disease follow-up that we do. So we have our health educator, a small amount of her time allocated to utilize this pot of money. And really no changes there. Our grant decreased by, I think, $40 in 24 as compared to 23. Lead poisoning prevention, again, another grant funding pot. So we're skipping over one program in the book and we're on page 326. So this funding supports childhood lead poisoning prevention and case management services. So that would be for families with children who have elevated blood lead levels. And then, of course, in accordance with federal and state guidance that we need to abide by. So what we do is review all reports from the State Lab of Hygiene that come in, and we provide resources and education to families in in 2023 year to date, we have sent 81 packets to families with a new baby with education about lead poisoning prevention, lead hazards that may be in their home. And then we, depending on the elevated blood lead levels that come up in our system, we may need to do home visiting or lead hazard investigations. Oh, I'm sorry, yep.
Oh, that's
Go
good.
ahead.
I was just wondering, under this portion, do you team up with the Department of Health Services for like the state for like lead abatement for homes and things of that nature? I know from my previous employer, one of the things is we're one of the few entities in the state that were able to do lead abatement, and there were grant dollars and things like that. So I was just wondering with this, if that's part of the puzzle?
That is certainly a piece of the puzzle for assisting families with lead abatement in their homes. This particular piece of funding, we have a contract through the state, and we have separate, like, not a deliverable. Well, we do have activities we need to do, but we also have benchmarks that we have to follow. So that's a little bit separate, and we really use the funding for our nurse to do that tracking, to send those packets, to do a home visit as indicated, which we can do at lower levels of elevated levels. And then, yes, we can tap into the resources at the state and county level, because Winnebago County is also administering the Lead Safe Homes program. And it's not included here because they just recently happened, but we recently had 2 elevated lead levels that actually came in like the same week. And Todd and Liz, our public health nurse, have been helping those families get connected to services and, of course, doing our portion of investigations as well.
Thank you.
Okay, so yeah, like I just said, the public health nurse is really what's the staff time allocated to this grant. Then we have our immunization grant. So we notify families of recommended vaccines. We offer immunization clinics. We track vaccine rates. And this particular program is really looking at that what we call the 24-month benchmark. So how many kids in our city are getting their recommended vaccines by the age of 24 months, the vaccines that are recommended to them in that time period. So in 2023 year to date, 71% are meeting that benchmark. And in calendar year 2022, 71 met the benchmark. If you were to say late up to date, we have about 78 meeting that. So they have received all their vaccines, but they didn't do it exactly by their 24-month birthday. And just of note, our public health nurse is the co-chair of the Wisconsin Immunization Coalition, or NUWIC. So I'm very involved in the vaccination scene. Our budget. Oh, I'm sorry.
Speaking about the 71%.
Sure.
How is that tracking over time?
Right now, it's not tracking in the way we'd like to see it. We're not seeing those numbers coming up right now if we were to look at probably the last 3 or so years. So unfortunately, but also fortunately, that we have staff that are very involved in our regional group, looking at ways to improve vaccination rates. I think I have of 2024 objectives. So yes, to continue with our reminders and notifications to families, but also educating and sharing information with providers to kind of help that continuity of care and educating them on best practices and speaking with their patients and clients and such.
And do you have, excuse me, do you have data on the percentage of school-age children up to date on their vaccinations?
I don't off the top of my head. We could run a report for that, of course. And we do track student immunization compliance. So like our schools are about 98%
Okay, that was
compliant.
my question.
Oh, yes.
Thank you. And then it was, given the data, I was curious as to if you know why this grant funding from the state of Wisconsin has decreased by 15%.
State budget.
That explains it. Thank you.
That's a really good question, and I did not pull that number for you. I could follow up with that if you'd like.
Thank you, Mayor.
Yeah.
Just one question. For the immunizations, are those free from the city, or do they have to pay for them from somebody?
Oh, yeah, that's a great question. Any vaccine we administer under our Vaccines for Children program is completely free of charge to the client.
Okay, so
recipient.
71% are taking advantage of getting free shots and the other
Not quite.
29% are not.
So the metric of 71%, that's of all children in the city.
Okay.
So some of those may have come to us to receive their vaccines, some of their vaccines, one of them, all of them. And the majority of those children would have gone to see, most likely, their regular provider for
Okay,
those vaccines.
family doctor, okay, understood. Thank you.
A maternal and child health program, page 330. So this grant funding we utilize to support activities to improve the health of mothers and children. And specifically, we're really working on breastfeeding friendly workplaces. Not so much recruiting new child care centers anymore because it's been an objective for quite a few years. However, it's definitely supporting the ones that are doing breastfeeding friendly work. And we had this year our public health educator and public health nurse, who is also a lactation counselor, attended our virtual MCH summit that's put on through the state MCH program. And then our educator actually recreated the Breastfeeding Community Resource Guide with our Breastfeeding Alliance of Northeast Wisconsin, so another coalition of tri-county areas, health departments, as well as healthcare and other stakeholders. And then she did continue to designate the currently designated child care centers. That should say continue to support designated, true. For 2024, we are looking to add some activities more related to improving continuity of care. So similar to that immunization grant, looking at working more closely with other stakeholder partnerships and improving practices to improve continuity of care. Our grant funding for this one actually increased a little bit as compared to I put 2022, that should have said 2023, which is nice for us to be able to spend a little bit more time on this. And we do have our health educator allocated to these grant funds. And as I mentioned, we do also have a public health nurse who's a lactation counselor and does some supporting work in this area. Our dental sealant program. So this is the other piece of the overall dental oral health programming that we provide in the Menasha Joint School District. So again, preventing tooth decay. And we seek, of course, parental consent, and then the student can receive any of the oral health services that we offer through this program. So some of those numbers there, 108 children received sealants in the 2022 to 23 school year, over 500 topical fluoride varnish applications, 67 oral health presentations in the schools. So those would be classroom presentations. And then we attend the annual Wisconsin Seal a Smile meeting because this program is in part funded by a Seal a Smile grant. It's $4,925 that we can receive in 2023 to 2024. It's a mid-year to mid-year grant. And then we also have medical assistance reimbursement for this one as well to offset the costs. And the notable change in the budget this year really is that we're looking for an additional $1,000 to purchase a specific piece of equipment that is utilized for doing sealants. We have our dental hygienist, of course, on this grant, and then some time for a dental assistant allocated as well.
Thank you, Mayor. In this budget, and in a few others, there is a wages temporary help line. There's money allocated to that. Could you help me understand what exactly that is? It appears also in the dental program budget, and there's another one here.
the Health Department budget would have that as well.
Okay.
Yeah, so in the dental sealant and then the dental program budgets, the wages temp help line 1008 is for our dental assistant. That position is vacant right now. We are attempting to hire for that, so we did build that into the budget, assuming that we can hire someone. Again, it is a position we typically have, it's just we had somebody for a while in the spring, and then they did resign, and now we're left with a vacancy again. So that position, because of the small number of hours, it goes into our temp help line. And then in the health department budget, you would have seen that as well. We do have some dental assistant time allocated there because we have that position work on health screenings in the schools. And then it's also for our Spanish interpreter translator who works, she's also like a 5% employee.
Okay, thank you.
Okay, next is our overdose data to action grant. So this is, the budget is on page 335. Catch up here. So this grant we utilize to create our Menasha Community Addiction Assistance Program. A number of years ago, we really started that work in, I think, 2018. And it's a collaboration between us, the city, various city departments, in particular the police department, and Unity Recovery Services. So, and the goal is to improve access to treatment and recovery services for individuals affected. This funding has all been utilized. It was originally a short-term grant for a few months, and then it was like a year, and then it was, I want to say, a 3-year subsequent period. And now that period is complete, so we are ended on August 31st. That was the end of the funding period, the project period. And the state did receive another iteration of an overdose data to action grant. However, they have chosen to utilize those funds to really create harm reduction centers in the state, and therefore are not turning that around for locals to apply for in this kind of same manner that we used for MCAP. So there is no 2024 budget, but I did want to make sure that we included some of the accomplishments. And our health educator has a final report ready to go, so we're hoping that we can get that published as well in your packet soon. So since we began in 2018, we had 243 residents referred to our program, and referrals really came predominantly from our police department, some from our fire department, a couple from the library, and that was really the referral network. Over 120 accepted services of some kind once they were referred and contacted, and then 25 of those people sought outpatient or residential treatment services. And then another highlight of this year was Unity Recovery Services was able to begin and enhance more harm reduction outreach. And then I have here just a little bit of information, so number of referrals by year, so you can see we peaked in 2022, however 2023 wouldn't have been an entire calendar year. And then our percent of referrals, this was really a grant focused on reducing opioid use and poor outcomes, and you can see that alcohol actually was the predominant reason for referral, with opiates being second. So just painting that picture of what people were struggling with in our community. Any questions on this? Okay.
Thank you, Mayor. Not so much a question, just want to acknowledge the fantastic work that you were able to do, so thank you.
Yeah.
And for everybody, all the departments within the city, this is a crisis going on, all across the country and our state, so thankful to see that folks were able to utilize this and get help.
Yeah, thank you. And I would give a shout out to our previous director, Nancy McKinney, for really spearheading bringing this work together, and our previous police chief, Tim Styka, for also being ready to go and on board right from the get-go to create something really cool. I would mention that while we don't have this funding anymore, that really means that staff on the city end and Unity's end can't do, the tracking that was really involved in this and the extra layers. However, we still have a partnership with them. They still take referrals. That's part of their job. So, we still have that contact in place for our residents to be referred to. Our bioterrorism grant next, page 336, 337. This is pretty self-explanatory. It's really for bioterrorism, preparedness and readiness to respond to public health emergencies. In '23, we utilize funds to support work on our influenza vaccine clinic because we run it as an emergency preparedness exercise, which means we use our ICS structure. We utilize, our radios and communication procedures. Our public health educator is funded on this grant, and she worked with our preparedness consortium to update our emergency preparedness plan. Our consortium, again, is a small one, but led by the city of Appleton. They have a more dedicated position to preparedness. And our educator is attending the ICS 300 and 400 training, so a little bit higher level training for that position. The 2024 budget is very similar for wages and fringe, a little bit of a decrease there in order to increase, though, our training budget so that our educator can attend the 2024 Preparedness Summit. We plan to continue with updating our emergency preparedness plan. We continue to hold an annual influenza vaccine clinic, so that is the plan again for next year. And then engaging more with partners in the community and supporting preparedness in that manner. So personnel, we do have the health educator, as I mentioned, and then a little bit of time for our dental hygienist. She does some she participates, of course, in the preparedness planning and exercising that we do, but also more specifically, she helps us with our communication drills that we do like on a quarterly basis. 24/7, very simple here. We have just some money to pay for our cell phones for 24/7 communication. It's a fund balance reserve that we utilize for this. Just a little bit of a decrease based on the cell phone cost, service cost, not actual phones. And then my next slide here, this is where I have you, I'm sorry, jumping a little bit around. I did just feel this kind of made sense to group them together this way. We have 3 of our COVID-19 grant funds that we have had for the past few years, depending on which one you're talking about. But all 3 of these will not have a budget in 2024 because the funds have been expended. So the first is our tracing and detection pot, and that supported case notifications, disease investigations, data reports, and website communications, pretty much from the time we got that grant up until when we really wound down that work this year. Our FEP workforce grant, we did fund a limited term public health nurse with that this year, and she did specific COVID-19 response and recovery work, as well as branched out to some more intentional health equity work with some partners in our community. And then we were able to use this fund to send staff to various conferences and learning opportunities since we have that opportunity with the funding. And then the third one here is our COVID-19 vaccination pot that we finished spending the last like $800, I think, by March of this year. We had really used the bulk of that in 2022. And that, as it says, could be used for pretty much anything related to our vaccination efforts, clinics, and staff time for COVID-19. The next one, so now we're going back towards the end here, so page 340, I'm sure it's 341, starts the budget. So this is our health ARPA grant. The This was our largest pot of money that we have coming out of the pandemic here. And our scope of work for the ARPA grant is there's kind of a synopsis there at the top. So providing resources to meet and address public health needs, and that includes measures to counter the spread of COVID-19, also supporting programs and services that address disparities in public health outcomes that have been exacerbated by the pandemic. And then they did actually update our scope of work to include addressing administrative needs like technology infrastructure. So in 2023, some accomplishments, we were able to shift our public health nurse position onto this grant when our workforce development funds were all spent. And we were able to utilize this to cover that remaining COVID vaccination efforts that once our dedicated vaccine pot expired, we could use this to step in and help cover those costs. We were able to purchase new radios for our health department. We have 6 radios that we use. We use them at our flu vaccine clinic. We have them in case we need them and test them every year. And we were able to get new ones. And we also purchased more suitable office lobby chairs. That really came from seeing a lot of older adults coming to our office for COVID vaccines, and the chairs that we had were very low to the ground, and some of them didn't have arms, and it was very difficult for those clients to get in and get out, and so we were able to get this approved with that funding. Our 2024 budget reflects the remaining funds left to spend. We included a training budget. We have a technology budget, technology supply budget there. That is for the purchase of our Microsoft Office upgrade. So we're really happy that we can utilize these funds to support that, because being able to have those additional capabilities of virtual work, meetings, things like that was a direction that I think the pandemic showed us that would be helpful to go in. And then we also have a large department supply line without knowing exactly where to put those funds, but we did have conversations that our objective would be to work with our Parks and Rec department to improve access to and enhance our outdoor recreation opportunities. So we're looking at potentially purchasing some fitness equipment to locate at certain parks or along the trail system. But really that would be the job of our public health nurse who's funded on this grant to do all that research, looking into the best options, finding the ways that the best fit for the community. So that's why there's a big pot of money there in that department line. And then, like I said, the personnel. So we have a limited term public health nurse, and that position is a 0.9 FTE. So that's reflected in that budget.
Thank you, Mayor. Do these funds have to be expended this year?
These funds do need to be expended by 2024, the end of 2024.
Thank you.
Then our last grant here is our public health infrastructure grant. That's the new one that council did just approve us accepting and spending. So you've just seen the nuts and bolts of this. Supports building capacity to implement the public health foundational capabilities. Oh, I'm sorry. There we go. Page 346. So there's that picture again of our foundational public health services that I had mentioned earlier as well. And our accomplishments this year, we completed the foundational public health services it's a mouthful, costing and capacity assessment, which is part of a statewide effort to assess the current capacity of the local health departments in Wisconsin. So this public health infrastructure grant is coming from a larger pot of money that the state has from the CDC. And so this is just a piece of what they're doing with their money. Some of it they are using to do this assessment for the state. and our capacity and ability to provide these public health services. So yeah, it's a new grant for us. It is funded by DHS, and in 2024, we really plan to kind of reinitiate department strategic planning. And I mentioned in another program that we have tri-county partners working on community health assessment and improvement planning. So we can utilize dollars for that effort as well. And then workforce development planning. That is a piece of public health accreditation that we don't have in place yet. So looking to utilize funds for that. And then just general staff training as it relates to public health, the foundational public health services. The budget as it stands is including our public health educator at 0.17 FTE. So good timing that we had this as our overdose data to action grant ended. So we were able to kind of make that shift. Any questions? That's my last slide.
Alderman Grady?
Thank you, Mayor. Thank you, Christine, for what you do for the city and the people of Menasha. But I noticed a couple of these grants, like especially COVID makes sense, no budgeting for next year. For the opioid grant money's kind of gone. But I don't know if there's going to be other programs you'd like to institute throughout to kind of replace this, and maybe there's grant money out there. My major concern is, mental health.
Okay.
And I don't know if that's covered in some of these health things or some of your main programs, but I know that's kind of on the rise, and it should be something that we kind of, if we can help do or look into, that would be appreciated.
Yeah, that's a really good point. I think even the last time we went through our formal community health assessment cycle, mental health was at the top of the priority list, not just for us, but our health systems are really narrowing in on that as well. And we do have a public health nurse who's very just interested in that topic and attends some work groups and is involved in some of that work. So that is kind of absorbed in our 0903 health department budget. But definitely we can seek additional opportunities, more intentional toward promoting mental health and wellness. Yeah, it's a great point.
Looks like no one else. Thank you, Christine. And we have the finance, assessor, and IT departments yet. ready, Jennifer? Okay.
Yeah.
So Director Sassman is here from the Finance Department to go through her budgets.
Thank you. We're almost to the end of night 3, so we're just about to our end here, which is good. So tonight I have the finance and assessor budgets. So in our department, I have myself as the director. Craig Pearson here is our finance manager. And then we have 2 finance clerks in our department as well. Sometimes I joke with the mayor about our accomplishments. I feel like they're not as flashy as other departments, or we don't have statistics. But, you know, we're often very much behind the scenes and kind of involved in everything. But our accomplishments just aren't flashy like other departments, I guess. This year, a focus that there was really a multi-department effort to update and refresh our city website. So that should actually be, I think, live by the end of next week. So that's been a kind of a couple-month project that we've been part of as well. We obviously completed all of our annual reporting timely and accurately. And kind of a month-long process is working with all city departments to develop a responsible budget, one that obviously fits within state levy limits. So that process, you know, started months ago, quite honestly.
And the thing you don't really have up there is your audit, which your staff spends an enormous amount of time each year putting that audit together.
Yeah,
and
exactly, and that
making
actually.
sure that the council understands what you're doing in the
Yeah,
department.
and they actually are here already in December for some preliminary days, so it really never stops. They start their cycle all over again. So for 2024, as always, just continuing to monitor our debt, focusing on the timing of when we would borrow for our CIP and in the manner that's most beneficial to the city. Always working with community development to monitor our TIDs on an annual basis to make sure that they are closing at least at a neutral position or obviously a positive position. And TID 4 is actually set to close by May 19th of 2024. That would be considered a 2025 closure, so we would still have the increment for 2025 for that. And then that TID would close with a, should be a positive balance, not much in the black, but definitely better than we projected a few years ago. One of the things that we want to focus on is having that citywide credit card acceptance. Once we have the website refresh all out there, is integrating that into the website as well. So that'll be our next step once that is live in researching those options. And another thing that we will be doing is looking at some new special assessment tracking software. That piece is still with the city of Neenah. We transferred away from their property tax software, and we didn't need to transition this particular piece yet, but we're looking for a software that'll track all of our special assessments and payments that go along with that. As far as the budget itself, that's page 211. Really very few changes outside of the wages and benefits. As far as the wages and benefits, in the 1001 wages line, you will notice an increase. 50% of the payroll clerk position was moved to the finance budget to match the structure. So therefore, you would see a reduction in the HR budget for that amount. So the wages along with the benefits going along with that will have been 50% moved into finance. Our account number that ends in 2103, that is our basic accounting service fees that we have, our audit fee, We have an extra OPEB audit, banking fees, investment fees. So that's a pretty standard account number. Our account number that ends in 2901 printing. A good portion of this is to have our property tax bills printed. The rest is check stock, envelopes, and that sort of stuff. The account number that ends in 2907, that is the finances portion of the IT budget, and I'll touch on the specifics of that during the IT budget. The account ending in 3012, computer and technology, we just have a couple scheduled PC replacements for 2024. Are there any specific questions about finance? Okay.
Thank you, Mayor. 2201, telephone. An odd thing for me to bring up, but I noticed going through the budget book that some increased dramatically and others decreased dramatically. What is causing that?
The phone, in the case of finance, I did budget for a city-issued cell phone for myself, something I probably should have done a number of years ago to keep that separate. But each department is basically charged a portion of our landline, and those charges should not have really fluctuated. And our cell phone contract did not change as far as dollar amounts. So if you saw a fluctuation, it would just be if a department was adding cell phones for whatever reason. But our contract amount did not change. There might be a few cases where some departments added a city-issued cell phone.
Okay, that makes sense. Thank you.
Yeah. So as far as the assessor, as you know, the city contracts with Associated Appraisal for our assessment services. Our current contract does end. It was a 3-year contract. It ends at the end of August 2024. So as we start into next year, we'll take a look at pursuing another contract with them or possibly going out for RFP. So we'll have that conversation in the next couple months. Obviously, continuing to work with the assessor to keep our assessment level as close to 100% as possible, which keeps our assessment values in line with market. And we do plan for a full revaluation in 2024. The whole city.
So what type? When you say full, to me, full is inside and out.
It wouldn't necessarily be, it would be all properties. It wouldn't necessarily be visiting inside every property.
So semi-full.
You could look at it like that way, yeah. But not just like this year focusing on new neighborhoods, permits and that sort of thing, yeah. Let's see, the assessor budget starts on
Can
page.
I add something to that?
Yeah.
Past practice, before the market got really crazy, was that every year a quarter of the city, 25% of the city would go through a reevaluation. But then the market started getting really crazy, and instead of doing 25% of the city, we started doing the whole city to keep up with the market.
Right. So we don't any longer focus on a specific 25% of the city. Really, we've kind of been basically doing every other year. 1 year, the full revaluation, and then focusing on, the other year on new construction and permits and that sort of thing.
Thank you.
Yep. The budget starts on page 208. The sub-account ending in 2109 is the appraisal line item, and that is our contract amount with Associated Appraisal for the entire year. Account 2501 is called Other Municipal Entities. This is a payment that we have to make to the Department of Revenue for them to assess the manufacturing properties. And then again, also, assessor is due for a PC replacement as well. Any questions on assessor? Okay. On page 213, we do budget a small amount. I believe it's $3,000. We have not needed to use this in the past couple of years, but basically it's some funds that are set aside for instances that come up that are property tax refunds that are usually could be due to an assessor error or a correction that has to be made. If those do arise, we are generally able to charge back the other taxing entities, so our portion is usually rather minimal if it does come to that. And then sometimes these funds could be used to, if the city would incur a loss on the sale of property that's being held by the county, if they don't recover all of the special charges and whatnot. But for the last 2 years, we haven't had to use these funds, so it's just putting aside a little bit of money just for that purpose. We also budget, I think it's 4,000. The account number, or account title is called uncollectible debt. That's page 213. So obviously we write off any debt that's past its collection period. And then annually we bring those accounts forward to council for approval. As far as the accounting of it, even though we may submit accounts to the collection agency or the tax refund intercept, we generally will in time receive those funds, but for accounting purposes, we have to record the expense when we send it off to collection. And if we should get that money back, it comes back to the expense. So just some money budgeted to record those types of transactions. All right. And then information technology, that is myself, the director. And then we have Andrea Oski, she is our network systems administrator. Brian Sankuel, he is our PC network specialist. And then we do also contract with Heartland Business Systems as a consultant as well. Some of our 2023 accomplishments, we were able to further enhance the security of our network. One of the things that we're currently, it's actually in the process these last couple of weeks, is the network security assessment. We had brought this forward, the agreement to council a couple months ago. So we'll have the results of that in a couple weeks. So we'll know kind of where we're sitting with things, and hopefully we have some positive news, but nonetheless we know where we will need to do some work. IT was also heavily involved in the city website refresh. Like I said, that'll be rolled out real soon. And we were able to use budgeted funds to purchase backup storage infrastructure. And basically, we ended up getting more than we had budgeted for, or it can do more, I should say, than we budgeted for. So we purchased the actual infrastructure. It also addressed some of our ongoing storage needs as far as space. And it also helped us with disaster recovery so that we can have this system that can power up in the case of an emergency, because it is located at the Public Works facility. So because of the same equipment for the most part, but it's doing more than we originally anticipated. So it's great news. And one of the things that we've also been working on is updating our information technology acceptable use policy. And it's part of our handbook as an appendix. So I think in December, we're bringing a number of handbook changes forward to the council. This will be one of them that we'll go through at that time as well. As far as 2024, we're looking to work with Heartland Business Systems to develop an IT security plan. We want to further enhance our network security. Once the network assessment is completed, we're looking to have that penetration testing piece done in the first quarter of 2024 as well. And that was part of what we had brought forward to council. And then one of the things that we've been throwing around a little bit about is possibly working on some joint training efforts with the city of Neenah as far as specific security training that could be offered by a company like Heartland Business Systems, and embark on that together with them. We'll be rolling out Microsoft Office 365 in the end of first quarter of 2024. And we're going to start to research some document imaging options. We had gotten a quote from at least one company so far to look at getting, again, a lot of those documents digitized, and just kind of looking to that a little bit more and seeing if we can kind of just plug away at that and start that process. And then another thing that we need to do is plan for our transition to Windows 11. I believe we have to transition by September of 2025, but we have to make sure all of our PCs are compatible, and then that the various softwares are compatible as well. And if they're not compatible, what we need to do as far as that. So that'll be a planning effort through 2024. Do you have a question, Randy?
I just saw that the outside services for Heartland for $25,000, and then that caused me to think a little bit about our health insurance contract. I know we have some company organization that monitors our health insurance account. How much do we charge, or how much are we paying that company to hold our money for our health insurance program? Go ahead, Stan. Okay. You're not functioning.
Yeah, I don't know. But anyways, I think he's talking about,
Just specifically about our HRA?
yes.
Yes.
Okay. I don't have that specifically with me, but I can get you that. But it wouldn't, I mean, it's obviously not part of the IT budget, but I can,
We can look at it
I
as
can
part of
get
the
that.
HR budget.
yeah, and that's tomorrow, actually, so.
Oh, okay. All right.
Yeah.
Thank you.
But I'll make a
That'll
note
be
of
great if
it.
I have it tomorrow. Excellent. Thank you.
Yeah, not a problem. Just a little background, I think I've gone through this before, but on the IT budget, just the structure of it. So the IT budget is an internal service fund of the city, just like our equipment fund is. So all city departments fund this budget. So most of the departments are going to have a line item in the budget. It ends in 2907. So that is that department's percentage of the overall IT budget. And then those, all of those line items in the individual budgets are a revenue into the IT service fund, and then that's how it operates. We did bring the IT budget forward to the steering committee just for their review. We talked through a number of things, and it was recommended by the IT steering committee. And obviously our goal is to, meet the needs of the IT department, but to be aware of that these are line items in every department's budget. So I do keep that, in mind as we're putting that budget together. The specific budget starts on page 170. The account 2104, computer and technology services. So this has a number of items in it. And I will note in the PDF of the budget, in the text version, I did have an error just in the calculation. In the text portion, I had specialized services. The total is correct, but I had specialized services at 26,000. It's really 11,000. I just didn't break out the numbers correctly. So in this account number is monies that we would pay to Heartland Business Systems, which again, we contract with them. This is a reduction from 2023. As I kind of anticipated, we are using them more on a project basis and for more security type things and their specialty knowledge. But they are certainly a resource for us whenever we should need them. We're just using them less and less, which is a testament to, our staff and what they are able to take care of. Also in this particular line item would be the funds to work on our cybersecurity plan, starting the document imaging. It's internet services and our website hosting are all part of that line item.
Yeah, back to the change that you just made. Was that a levy dollar amount?
Well, it's all in, this is in the IT fund, so the IT fund itself is not a levy fund
But it's coming from the other
from
budgets?
all of the departments. I just had in that particular account number,
Okay,
is it on
gotcha.
page?
So,
In that far right column, we can put
right. So
notes.
that
I just
number is
noted it
supposed to
wrong.
be, what was it again? 11?
Yeah, the total is correct, I just didn't,
So
Right,
even
the
though it
dollar
says 26, it doesn't matter because your budget itself, numbers are correct.
they are, I just
Okay,
noticed
so
I
it doesn't
didn't,
affect the levy at all
I just
then?
didn't break it out correctly, yep. Account ending in 2402, the tools and equipment maintenance, the increase in that line item is just due to, we have 2 copiers that are on lease. It's just due to the actual lease amounts that we know for 2024.
Thank you. Just a clarification on the Heartland Business Systems line item. You have budgeted $25,000, but we only pay what they bill for. They might not use that whole $25,000.
Exactly. What we do is we purchase block time with them, and then they will send us reports every month as to, what their engineers had worked on. But they do only bill us for requested services, or like if it's the once every 2 weeks, if we set up the time to go through specific things with us, but just when they actually do work.
And you mentioned that you decreased that budget amount. What was it?
Not that line item overall, but the part that we would be paying to Heartland, I decreased that, I believe, 3,000 or 4,000.
Okay.
Certainly not wanting to do away with that by any means, but we, have been using their services less.
So that's based on your $25,000 for 2024 is a reduction based on previous
Current
years.
usage. Exactly.
And usage,
Yep.
thank you.
The account 2104, computer and technology services, this is a number of things wrapped up into the sub-account, and a lot of it is what I would call kind of annual software maintenance type costs. It's a combination of department-specific costs and then global costs. And just to give you an example of some department-specific costs, they all run through the IT fund, but then they're really charged to that specific department. For the police department, it would be the server that we'd be setting up for their body cameras. It's called NetMotion, their cellular connectivity service. So sometimes there are these subscription types costs that are specific to that department. Engineering, their plotter maintenance. Public Works, they have a fleet soft maintenance program. Parks and Rec, they would have their rec desk software. Finance has the property tax software, our financial software. And then some of the global items would be, the annual subscription for the firewall, antivirus, our multi-factor authentication, our email archiver, things like that that are obviously used by every department. One of the things that was alluded to during Community Development's budget was the looking into permitting software. Because we don't know exactly what direction we're going in yet, we have this price range of the 40 to 60,000. Still don't know exactly the best, what'll best suit our needs. Assuming that probably year one is going to carry that largest cost. So, and not knowing how we might possibly break down that dollar amount within the IT fund. So I allocated a portion specifically to the inspection account, and then I included a portion of that in the global IT costs. And then if we would near more of the $60,000 range, then I would propose that we would use available fund balance. So when we know, more specifics as we get closer to narrowing in on a company, we'll kind of decide how we'd want to divvy that out to, various departments. But we just kind of broke it out a little, didn't put it all in the inspection department right now because of the unknowns at this point. Did you have a question, Ted?
Yeah, thank you. Going back to Alderman Nichols' question about the Heartland $25,000. So when you get to that range, you just stop? You don't do anything else with them? So if we could, for some weird reason, hit that by the end of June next year, then we just stop going through them? Or is that going to get,
I mean,
how do you, has you ever gone over? I mean,
we haven't, and I mean, again, that line item has about 5 things that we kind of earmark that for. So there would be, usually funds in that line item that we may not have used for another specialized service that we just kind of account for that could happen. But I highly doubt we would run into that situation. Really, if we would run into a situation like that, it would be if we had a vacancy, quite honestly, that we would go through the budgeted funds that quickly.
Thank you.
Yeah. The 3015 account, tools and equipment, this has money set aside for a couple different things. We're looking to replace the switch at the library. That's an aging device. Our backup infrastructure, our new infrastructure, has some additional drives that need to be purchased for that. And then also, I believe it's 2 small uninterrupted power supply units at the bridge. And then there's some money set aside for any other miscellaneous tools and equipment or supplies, I guess, that we would need throughout the year. And then the last item I would want to draw attention to, it's account 8001 under computer equipment. We are budgeting some funds to replace another uninterrupted power supply, otherwise known as a UPS unit. This is a large unit. This is in our a replacement in our server room at the police department. So this is something that's been on our radar for a number of years, and so we'll be wanting to purchase that in 2024. And I think that's all I have for the IT budget, unless I have any other questions. All right. And just on the debt service fund, I just wanted to draw attention to a couple of things, because the debt service fund obviously is a levy fund, but I mean, that's really primarily driven by matching our principal and interest payments that are due. So that levy did increase by $130,000. And again, it's really just to match those principal and interest payments that are coming due for 2024. Also, on a good note, our debt service fund balance, if you've recalled from our audits the last couple of years, and we knew this, and our auditors knew it as well, but we were running a negative fund balance for a couple of years. And if our revenues truly track like I expect them to by year end, we will be at a positive $140,000 for fund balance, which is great because it gives us a little bit of cushion. Obviously, much better than being negative. And then 2024, we would stay hopefully positive as well. So getting out of that negative fund balance is a good thing. And then I just wanted to actually pulled this slide again from the mayor's presentation, but I just wanted to again just show our GO debt over the years. And then the 2024 amount, actually I should back up. The 2023 GO debt amount includes our borrowing that we did earlier this year with Covantage for the developer projects, so that would have been for Woodland Lakes Cottages in Lake Park Heights. We will borrow for our 2023 CIP projects in 2024. So that amount of the $35,625,000, that will be our GO debt amount after we borrow for our 2023 projects. And then obviously our 2024 CIP, we are going to see an increase in our GO debt because we will be taking on more than we'll be paying off. So our 2025 amount will be going up from where we're currently at. And that's all I have.
Any other questions for Jennifer or Craig? Alderman Sevenick?
Thank you. Can we go back to your final comment about 2025?
For the GO debt, where it will land?
Yes.
Yep.
So you're projecting a higher amount
Yeah.
based on,
Based on our CAP that's in the budget right now.
based on what we're looking to possibly spend on our capital improvement?
Yes.
Budget,
So
okay.
what we would intend to borrow for, there's also a piece of accessible projects, but we borrow for that, because there's the 5-year deferral. And then if we do move along with, there's 2 developer projects as well. If we would move along with those in 2024, those would have a borrowing as well. So if all of that happens.
What percent is accessible, roughly?
I do have it.
So although it is,
It's a little over $1 million, I think, would be
Okay.
accessible.
okay,
Yeah. But yeah, like I said, I can get the kind of the projected for 2025, but we would really be taking on more than we'd be paying off at the end of 2025.
mainly because of our deferred assessment policies?
Yeah, generally, we almost always borrow for that because there is that 5-year deferral, so we wouldn't be able to float that, those funds until the payback would start.
Okay, so just help me out here. The city garage. We're not doing a city garage this year. How is it that the debt is that much higher from 2022 or whatever?
Well, in 2023.
What's being spent so much that we'll have this much more debt? Is it more development going on or what? Because I'm confused.
Yeah,
Because I
so-
thought our debt should be down by a great amount.
Yeah, so where were our GO debt amount at the end of 2023, the $36,490,000, that includes the borrowing we did earlier this year. So we went to Covantage to borrow for those 2 developer projects, and those were, the Woodland Lakes Cottages, that was, I believe, like 3.6 million. And the Lake Park Heights was maybe like 1.1 million. So that is where we're getting that number. And then right now I'm projecting that for the 2024 GO debt amount, that $35,625,000, that would be borrowing for about 1.9 million of 2023 CIP projects. And I can go over tomorrow, kind of as
I was
a
going to say that's
recap.
coming up tomorrow.
Right, just kind of CIP where numbers are kind of shaking out as far as that, like what's, really proposed, what that means and what it means for our borrowing.
Yeah, because I would have thought that after the city garage, it would be coasting lower, not staying almost level. So, all right.
Okay. Yeah, the CIP is basically what we looked at in in August.
Yeah, and there were a few
About $4 million, I believe.
modifications, but not a lot.
So, yeah, Jen and I will work on something to kind of explain how that all fits together for everyone.
Yep, yeah.
Any
What
other
it, what it means
questions?
ultimately for our debt, yeah.
If we don't have any other questions, I would accept a motion to adjourn. There's a second? So motion and a second. All those in favor? We are adjourned. Thank you.